sensitivity. Do we know the percentage of calcium levels which are deposited on the dentine? Yes, about 70%. Is it the reason why it's sensitive? Yes. But another reason is that when you look at this critically, you'll realize that this part is living, because somehow there is some sensitivity in this area. That's why sometimes when people are eating something hot, he will tell you that, you know what, I don't want hot things. When you take something cold, somebody will say, you know what, I don't want to drink a cold beer. I want a warm beer. And sometimes when you blow some air, when you come to a dentist and they blow some air here, somebody will say, yeah. There is some sensitivity. Please stop, doctor. Stop, doc, stop. Because there is exposure of the enamel. The reason is simple. This area is living. The enamel is dead. That's why you're not feeling pain. So because this area is living and the amount of calcium deposited is not adequate as this one here. Here is over 90%. Here is 70%. But again, sometimes when you look at this area here, this is what we call the cemento junction enamel here, this area. Enamel, and you are looking at this area. The dentine is here, the enamel is here, but beyond this area, around this area where there is a bone, there is a cementum. So that's why we call this the cemento. This is a cementum. Then this is enamel. This is a junction. So this is the junction between enamel and the cementum. This area is very sensitive. Why? First of all, there is some food which is deposited here for the benefit of the tooth. And normally, bacteria also want to come and be in this area. And normally, it looks for some kind of nutrients around this area. But that's not important. If you look at this other part of the root, the covering of the root is what we call the cementum. Some people call it cement. It is less calcified again compared to the dentine. How much is it? It is very, very little. Between 40 and 45% of calcium is deposited here. That's why it is even more sensitive. Like if you brush your teeth with a lot of force and with a very bad toothbrush, which is hard, you will be affecting this area, especially horizontal scrubbing. Therefore, you'll have sensitivity in this area. But let's focus. If the tooth decay has left the enamel, it goes to the dentine. Beyond the dentine is what we would call the pulp cavity. Pulp cavity is even more sensitive. Ladies and gentlemen, we're talking about phase 3. You can critically see here that blue here is the enamel. Then this other part, which is yellowish here, is the dentine. Here, no pain. Here, sensitivity. Now, when you look at the innermost part here, this is what we call the dental pulp or pulp cavity. What does it have? It contains the pulp, but this area is called the pulp cavity. So this is the part that houses the nutrients to the tooth. It is the one that contains the nerves, the blood supply, innervation, everything is done in this area. Meaning all the food that supplies the tooth is stored in the dental pulp. Therefore, because it is carrying the sensory nerves mentioned, now what will happen is that it is going to send signals to the brain that there is a problem. Therefore, you will be having some pain. You will try to put the head down, it is even worse. Why? Because the tooth structure by nature is made of a bony substance. So, this soft tissue inside is being housed by bony substance. It is like you putting fire in a chimney and you close where the aeration or the smoke is supposed to come out from. You'll be feeling a lot of pressure. That's what happens exactly in tooth decay process, especially when the pain starts. It only starts once the decay has entered the pulp cavity. Normally in this case, all people will want to seek the attention of the dentist. Even if you have shared a woman, you have shared a man, you will have to go to that dentist and say, excuse me, let's solve our differences. I've come, I want you to treat me. Here, no compromise. And once the problem reaches here, in most cases, most people go to dictate. This pain has disturbed me for long. I want this tooth out. They actually go and begin ordering the dentist. Why? Because the pain will be unbearable. And in most cases, you'll find the person with pulpitis. Pulpitis, ladies and gentlemen, is the inflammation of the pulp. Normally, a person will say, be it or not, remove the tooth and throw it in the dustbin. I even don't want to look at it. Some people will pick a tooth and say, let me go and show it to my children. This tooth has given me a lot of headache. And normally, it is a serious one. Ladies and gentlemen, sometimes this pulp may stop to pain if you took some drugs. And it dies. When it dies, you may think the problem is gone. We have got another phase, which is the fourth phase. You look at this critically, that the pulp now is black, it has died, but there is this inflamed area at the apex of the tooth. This inflammation is what we call an abscess. You will wake up in the morning one day and see the whole cheek is swollen, sometimes covering the eye, if the problem is on the upper part of the tooth, especially on the mandible. I mean on the maxillary part. The mandible is down, that's the lower jaw. The upper one is on the upper jaw. But still, the problem can occur on either jaw, either on the mandible or on the maxilla. You'll find the cheek is swollen, and you'll see the reddened part. If the dentist examines you extraordinarily, you will actually see a swollen part of the cheek. This is what normally brings also people to the clinic. And in most cases, this pass, it is really very painful, sometimes very tender to touch, let alone to percussion. Meaning just touching that area. Somebody will tell you, excuse me. You will throw your hand very far even if you're a dentist. You try to anesthetize, this patient will tell you, excuse me, I still have a lot of issues, there is pain. Until probably you have to find all possible ways of ensuring that you continue giving this person anesthesia until you can be able to drain the pus. If not, you have to put somebody an antibiotic and then discharge the person, and maybe in order to control the infection. Then later on tell the person to come for extraction. Ladies and gentlemen, as we conclude with this session today, it is very important for us to note that tooth decay is important. And for tooth decay to occur, there are 4 major factors. For a tooth decay to occur, there must be a tooth involved. There must be a tooth in your mouth. And the tooth structure is very important. There are some teeth that do not favor tooth decay, especially the incisors. Because of the nature of the incisors, whether central or lateral, they are very easy to clean, because saliva plays a very key role in neutralizing the acid which is formulated as a result. So if you have a lot of saliva, you know it is advantageous. Don't keep spitting it all the time. Leave the saliva clean and neutralizes the germs or the bacteria that causes the tooth decay. But also once in a while, smile. As you smile, you are able to allow some of these factors being destroyed. Eat something. Eat a fruit, not just snacks. People like snacks. Eat a fruit. Yes, some fruits actually have got, especially fibrous fruits, they can clean your teeth very well. Second factor that we talked about is bacteria. Bacteria is very key. For a tooth to decay, there must be bacteria. There must be food. There must be time given to bacteria to look for food which has got sugar, which sugar will be converted into an acid for you to be able to have this problem. Ladies and gentlemen, going forward, the most important factor is the time factor. Never allow bacteria to cause a lot of disaster. What are we going to do? Break the chain. How will you do that? Brush your teeth. Will I carry the toothbrush all the time? Maybe not. What am I supposed to do? Rinse your mouth. What is important for you to note are when to brush, how to brush, and why brush. That will be our next lecture. Ladies and gentlemen, always do the right thing, because it is the only thing that is going to save you. I wonder, some people wake up in the morning, they waste a lot of time. Somebody is 40 years and he wakes up in the morning to brush his mouth in order to darten it with the food, and he forgets that food, once introduced in the mouth, will be that which should have been removed after brushing. Meaning what? Wake up in the morning, you can go take your bath, wash your face if you must, go rinse your mouth if you must. You can brush even if you want, but know that the most important brushing is after the meal. So after maybe rinsing, go and tackle the breakfast. Remember, the heaviest meal should be breakfast. That's why we are calling it to break the fast, meaning it should be very heavy breakfast, light lunch, and probably no dinner. You will be a healthy person. Ladies and gentlemen, brushing is done after meals, and do it after breakfast, after lunch, after dinner. Why? Because we are saying the time factor is the most important factor in tooth decay. If you cannot brush 3 times a day, then brush once. And the most important time for brushing is when you are going to bed. Why? It is the longest time you are going to give bacteria to be able to work on you. That's the reason why when you wake up in the morning, the mouth looks smelly, as if you have taken alcohol. Even if you have not been taking alcohol, the brewing has been taking place in your mouth. Why? Because all of the factors are there. There is water, your saliva. There is yeast, the food you have taken. There is a person who is doing the fermentation, the person who is brewing. That is the bacteria itself. At the end of the day, what is the result? There is alcohol. And that is what causes problems, ladies and gentlemen. Your spouse does not want to meet you, does not want to sleep facing you. All the time, your spouse saying, "Excuse me, darling, let's sleep," and turns the back to you. There is a problem. You have a problem of halitosis because you are not brushing after meals. Ladies and gentlemen, having said this, plan every activity. Plan when to brush. Plan how to brush. Go to your dentist. Have a checkup done. At least after every 6 months. You will be safe. Be happy. Don't worry. Visit your dentist. We shall always be there to serve you. May the good Lord bless each of you as you plan to go and buy a very good toothbrush and buy a fluoridated toothpaste and always apply it rightly. Remember, a right thing is a right thing, even if nobody does it. And a wrong thing is a wrong thing, even if everybody does it. Ladies and gentlemen, remember to visit our YouTube channel. Just type Okwadi 2K. Remember always to subscribe and like. We shall be sharing this knowledge all the time. Remember, knowledge is power. And knowledge can only be called power when you share it with others. For if you don't share knowledge with others, you'll be like that peasant farmer from Kasoka village where I come from, who plows the gardens and fails to sow the seed. So always subscribe and share. Thank you.